Switching things up a little bit, Mark, we've talked about the science, we've talked about what we need. How about owners? What is the current state of owners, our pet owners understanding of pain and pain management, and if we need to improve it, what can we do to improve that?
Well, owners are afflicted just like veterinarians in this way. On the one hand, it's probably their most vigilant thing. If you would ask them what is the one thing they would most want to control and prevent in their pet, it would be pain. On the other hand, we encounter chronic pain, especially osteoarthritis related pain, casually. It's in the exam room on a routine, semi-annual or annual visit, and either by volunteering information or being prompted for it, the owners will report not being really active in the morning, being stiff in the morning, stiff after exercise, not jumping on the couch anymore, doesn't like the stairs. I have to help him in the truck to get over here, but fortunately he's not in pain because they haven't made that, there's a disconnect, and they haven't made that relationship between those limitations of activities of daily living and the pain that the patient is experiencing and the sarcopenia and other things that will be starting to happen. The hazard is in that exam room because the owners are not seeing vocalization, they're not seeing limping even. If it's a unilateral problem, maybe, but if it's a bilateral hip dysplasia, then maybe not. They're not picking up on the conformation changes. That we veterinarians, in primary care in particular, we have maybe 10, 15 minutes, I'm afraid, of contact time with that client. And if they're older, we've got to talk about lumps and bumps and teeth and ears and half a dozen other things in the context of that. And how do we get started with a discussion that really is going to impact this patient and that relationship, that bond with that family for the rest of its life? It's a real hardship, and it's easy enough for the veterinarians to kind of affirm that, well, he's probably okay, maybe here's some non-steroidals and pass it on and not do the kind of follow-up. So it is incumbent upon the veterinarian and the veterinarian's team to be aware, to prompt the right questions, and to pause when there's either historical or physical exam evidence of osteoarthritis, and somehow have that conversation, even if it's after that particular visit. You have to follow up with email, phone call, or in person to really set the course for what that patient is going to happen for the rest of its life.
And what's interesting is, you're absolutely correct with that disconnect between what they're seeing and assuming it's a normal aging change versus a clinical sign of osteoarthritic pain, right? Because we've all had those patients where we say, this is what we think is going on. Can you try a non-steroidal for a few weeks, see what you think? And they come back to you saying, it's like a puppy,
right?
And so clearly those clinical signs were of pain that the non-steroidal is helping with in those osteoarthritic patients. So.